Ultimately, the better a patient understands their care and the more actively they are engaged in it, does two things. One, they're better cared for, and secondly, it's actually more efficient for you and your office the more time you spend educating them and making sure that they're involved. What I'm looking for when I speak to Mrs. Orr is active listening. I want to see that she's with me, she's reacting to the things I'm saying, that she hasn't drifted off because I've scared her and she's off into stroke risk. Who would take care of me? She's following with me as I go along, and I stop if she's not, bring her back to the conversation. I try to pace the amount of information that I dispense because educators will tell you, you can get across 3 to 5 points. That's a maximum. Learning is facilitated if you give the person a short break. Make a comment about their spouse, this or that, what sort of leafy vegetables do you like, and bring them back to the subject matter. So I want to see that she's actively engaged. Pace the amount of information that I dispense and give her some pauses to absorb some of that, move on to the next point. I want to know that she's understanding by periodically asking her a question that'll lead to her reiterating some of the teaching, or just asking her, can you tell me what I just said? Because that's critical and I want to make sure that you've got it right. The other thing we want to do is give her enduring materials that she can take with her to reference later, and will help her have the discussion with her family, because learning is going to continue when she describes all this to her husband tonight. If we can give them materials, that's great. And finally, I'd like to have some online materials that we can give them or reference to them. And last, to have your nurse or your physician assistant call the patient in a couple of days and reinforce the teaching, I think is critically important and goes a real long way. So hopefully with all those things, we get an actively engaged patient who understands their care, is participatory in it, and when we have that, everyone wins.